Panelists, program sponsors, ladies and gentlemen, thank you for being with us today for our discussion on scalp cooling and the importance of access. I think you all know me, but I'm Roberta Lombardi, and I'm the founder of Infinite Strength. I want to begin by thanking our sponsors today. You may have heard me say that I like to think of Infinite Strength as the helpers to the metastatic breast cancer community, and I think our sponsors in that same way. So thank you to Pfizer, Gilead, Seagen, Genentech, and Lilly. Thank you so much for recognizing the importance of bringing these programs alive for patients. I also want to give a really special thank you to Paxman Scalp Cooling. While our discussion today is about scalp cooling in the general sense, the Paxman family has been with Infinite Strength since our beginning in 2018. The two patient advocates that you're going to hear from today have utilized Paxman Scalp Cooling, and it is offered here at Yale. And, you know, one of the reasons we've partnered with them is largely due to the compassion and the kindness that they show to the patients. And that's so important when we're talking about preserving one's dignity. Infinite Strength is dedicated to providing underserved, underrepresented single mothers living with metastatic breast cancer financial and emotional support. And with that is that quality of life piece, right? We want to make sure that we're giving them the opportunity to have a better quality of life. And that's the tie-in to our discussion today, because hair loss is so much more than vanity, and hair loss has such a devastating effect on a person's self-esteem. It has an effect on them mentally and emotionally. And I think you're going to see here today that it does play a role in how they handle chemotherapy and active treatment, and then how they recover once they're through with active treatment. I think once you hear from our panelists today, you're going to agree that this goes along with our pillar of quality of life. And with that, I'd like to get started and introduce you to our panelists. Dr. Miriam Lusberg is the Director of Breast Center at Smilow Cancer Hospital and Chief of Breast Medical Oncology at Yale Cancer Center. Dr. Sarah Shellhorn is the Associate Professor of Medicine, Yale Cancer Center. Angela Kerala is the licensed clinical social worker at Smilow Cancer Hospital. Elisa Riccatelli, Women's Oncology Registered Nurse, Smilow Cancer Hospital. Brooke Deans, wife, mother, businesswoman, breast cancer survivor, and scalp cooling patient. And Abby Dillon, breast cancer survivor, thriver, living with MBC, and also a scalp cooling advocate. And we are so thankful to have them. Thank you so much for being here. Dr. Lusberg, we're going to start with you. Why do you think chemo-induced alopecia, which for many patients is the most traumatic adverse event of chemotherapy, why do you think it's been one of the things that the medical community has been the least concerned about for so long, and how are you trying to change that here?
Yeah, thank you, Roberta, for helping organize this, and thank you to all the sponsors as well, and my fellow panel members for being here. Yeah, I think it's how we think about treatment and really bringing in the patient voices and patient perspective, and how we make treatment decisions and how we deliver care. I see that definitely changing in the last decade, where we're increasingly recognizing that patients need to know all their choices, and hair loss, if it's impactful to them. Every individual is different, and so I think it's important for them to know that there are options to mitigate hair loss if that is something that's important to them. And I think really bringing in the patient experience and patient voices and how we deliver oncology care is a shift that is happening in oncology, and it's something that I continue to see that change. So to your question specifically, I think the focus in oncology for a long time has been, let's get the cancer, let's treat the cancer, which is of course an important goal. It's something that our patients care about, we care about. but it doesn't have to be an either or. It can be an and, that in addition, we can also make thoughtful decisions about ways that we can manage different toxicities and really personalize how we deliver that care. And scalp cooling is one of those options. So it should be part of the discussion of really, when we're discussing a cancer treatment, I think it's important to, of course, talk about the various toxicities, and hair loss is absolutely one of them. And I wouldn't want my patient to leave my office without at least hearing that there are options for mitigating it.
Thank you. Dr. Shellhorn, you and I have had conversations in the past about hair loss, and I remember you telling me that for a very long time you did think that worrying about hair loss when faced with a cancer diagnosis was a question of vanity. And then through your patients, you came to realize it was very much about dignity. Can you tell us about that?
Sure. Thanks again, Roberta, for inviting me to participate in this panel. And thanks also to the sponsors. I think when we think about hair loss, it's not medically important, but it is so important to a patient's self-esteem, to their self-consciousness, to their overall well-being, and how they present themselves to the public in their profession, in their social life, to their children, if relevant. And before we had the scalp cooling option, it was something that people, my patients, were very, very concerned about, because not just about the hair loss itself, but this presentation of being sick. They couldn't hide that. They had to explain, why their hair was missing. And I think that with the ability to mitigate some of that hair loss with scalp cooling, it gives patients not only a sense of dignity, but a sense of control, a sense of normalcy, a sense of being able to live the life that they want to lead while undergoing what can be very intensive cancer treatment. So it's very important to many patients. It's not important to everyone, and that's their own value system, but it's important to explore it. It's important to offer it. It's important to have this option for all of our patients undergoing chemotherapy.
Thank you. I should say here that Dr. Shellhorn was my oncologist, and Yale got Paxman right after I ended treatment, but it was thanks to Dr. Shellhorn that I got introduced to scalp cooling. When we began Infinite Strength, she invited me in, and that's how I got familiar with the system and with the Paxman family. It was amazing. Angela, many people who have not personally had breast cancer touch their lives. They don't understand the body image issues breast cancer can cause, nor do they fully understand the psychosocial impact of hair loss due to chemotherapy. I mean, it's a trauma. Can you tell us about the trauma chemo-induced alopecia inflicts mentally and emotionally on the patients you speak with?
Absolutely. And again, thank you, Roberta, for having us here today, and to Infinite Strength, and for all of you who are joining us today in the audience as well as by Zoom. And it's such a wonderful opportunity to be here today to speak to all of you. What we know is that when someone's diagnosed with cancer, it impacts all aspects of their life: socially, emotionally, spiritually, financially, and even sexually. That oftentimes is quite often overlooked. When a woman is diagnosed with breast cancer, there are so many losses that she experiences. One of them is a loss of sense of control. And hair loss is something that's really challenging to control when a woman is going through breast cancer treatment, unless, of course, she has made the choice or been provided the opportunity to pursue something like scalp cooling as a resource for her. Hair loss has been reported to be one of the most psychologically distressful effects of chemotherapy. And there was a study, many years ago in 2014, but I think it still is relevant today. It found that around 50% of the women who experienced hair loss reported that it was the most traumatic effect of chemotherapy. And 8% of those women indicated that if they had a choice, they wouldn't have pursued chemotherapy because of the hair loss they experienced. And even more striking was many women reported that the loss of a breast because of a mastectomy was actually less traumatic for them than their hair loss. And to me, that is just overwhelming to hear and overwhelming to, see. I'm actually going to take a different approach, and I'm going to just share with you some examples that women have shared with me over the years. And one of the things that I have heard from women, that they'll say they're so shocked, they're so overwhelmed and surprised at their own emotional reaction when they start to lose their hair and they see the pieces on their pillow, or it, collecting in the drain, or they rub their hands through their hair and it comes out in clumps. And they'll say to me, Angela, I'm so surprised. I cannot believe that I'm having this emotional reaction. I'm not vain. I'm not superficial. I really don't even care about my hair. But why am I feeling this way? Well, the simple fact is our hair is directly tied to our physical appearance, and our physical appearance has to do with how we view ourselves, our body image, our identity. That is all tied together. And when we experience hair loss, it impacts those things. It impacts the identity, it impacts our body image, and it can result in having low levels of self-esteem as well as issues with self-worth. I've had women share with me, I can't even look at the mirror because I don't even recognize myself. This is not the person who I am. This is not the person who I was. Or they actually avoid, looking in the mirror altogether because it's so depressing for them and so traumatizing for them to be able to see themselves. A woman actually recently shared with me, she said, Angela, I was totally fine when my hair fell out. That was fine with me. But it's when my eyebrows and my eyelashes and hair in other places fell out, that was more than what I could bear. And again, it's because the hair loss has to do with our physical appearance. It's tied to our identity. It's tied to our body image. And for some women, it defines who they are as women, their sensuality, their sexuality. It's all tied into that. I've had women share with me that, it's a privacy issue for them. And we heard Dr. Sherholm talk about this a little bit, that, it's, women have said, when I had breast cancer, you were looking at me, you can't tell that I have breast cancer, but the minute my hair fell out, it became this public acknowledgement, this public announcement that I am a cancer patient. And I've had even women share with me who were able to have scalp cooling, that for them allowed them to have privacy, or they didn't have to disclose to or colleagues or people in their family or even in their friend circle that they were going through cancer and treatment. Another loss that women experience is the reminder that they're going through breast cancer and the reminder of the life that they had prior to being diagnosed. And that, of course, can result in, those feelings of sadness, depression, worry. With those losses and with that sense of loss of control, women will experience anxiety, fears, worries, sadness, trauma, anger, guilt. All of those feelings are wrapped up together. And they often struggle with those feelings and what to do with them. I've also had women, share that they really wish that they had opportunities to be able to, be able to talk about and express, how they're thinking and how they're feeling. And it's important to know and acknowledge that if you are struggling, if you are feeling this way, please reach out to your medical oncologist, let your medical team know. And in all of the care centers and in all of your clinics, there's going to be social work there that's going to be to help you and support you while you're going through this. One last story. I had a woman many years ago who avoided going out in public because she was so worried about her appearance. And she would even shop in a grocery store in other towns to not have to interact with people in her community who would maybe ask her, about her diagnosis or why her appearance looked different. And so again, thank you so much for this opportunity of being here today.
That all resonated with me. I used to, no, I wouldn't go to the grocery store. I hibernated. And the one time I'd make myself do something, I ran into people that I knew, and then I'd be getting that, how are you kind of look. And that's just what you don't want. That's just why you want to keep your hair. Elisa, there are some misconceptions and untruths about scalp cooling out there, and to varying degrees, but I was actually sitting with one of our grantees who was alone during her infusion treatment a few years ago. And she was a Black breast cancer patient. her doctor came to sit with us and asked her if she was interested before she started this first infusion in chemotherapy, if she was interested in scalp cooling. And it was presented as, and I'm quoting this, probably wouldn't work on your hair and would give you a brain freeze, so best to skip it. And I got angry because, I mean, why would you ever put it in those terms? It's a negative right off the bat. And of course she said, no, I'm going through enough. I'm not going to do it. Thanks anyway. And I was really so distraught because a few months later, she said to me it was the worst decision I ever made. So tell us about the importance of making sure patients are a part of this decision when determining whether scalp cooling is right for them, and what have you seen?
Thank you, Roberta. So during infusion, that's where I work, and I've worked there for the last 6 years. And when Paxman first started, we all didn't know what to expect for our patients. So it was trial and error. But what we did was make patients more comfortable. When they were freezing, we would give them blankets, hot tea. The most important thing for patients to know when they have that scalp, the cap on, is they are going to be cold. Their neck could get tight. They can get a headache. So giving them the side effects first and upfront so that they know what to expect is ideal, but not telling them that we can't manage those side effects is really helpful. And in infusion, we are always there for them. So giving them the warm blankets, providing the hot tea or coffee to make them warm and feel comfortable is ideal. We also assist them with applying their caps. Paxman has the videos for patients to do it independently, but up on the 8th floor of infusion, we really assist them, and they don't really do that independently at all. I probably have only had one patient who was able to do it independently. But I also had, Roberta, a patient once that told me her hairdresser told her not to do it because it would kill her hair. And I had told her about a patient that we had, one of my first patients that ever had the best experience with scalp cooling. She kept all of her hair and she stayed on that cap for hours, but she kept it. She washed her hair once a week. She didn't play with it, but she had this long, gorgeous blonde hair, and she kept it throughout her whole treatment. She came for weekly Taxol and did an amazing job. We always tell patients they're going to look like a chipmunk when they have that cap on and an old time football player. And the husbands try to, or their partners that are with them, or a support person tries to take pictures of them, which we try to discourage. But even now, when I'm in a new position for a practice nurse and when applying this and teaching them about scalp cooling, I try to give them the tools to bring warm blankets, as well as we have the heating blankets with us on the floor as well. That is probably the prime thing for patients, just to keep them warm. And even if they need to, a warm pack on their neck, because they get tight. Their neck muscles all get tight. And if we need to, we'll give them some Tylenol and any other kind of medications that will help make it successful. I try not to discourage them from it. I say, try it. If it doesn't work, we could always take it off. If it's really too much for you, we can stop it. There's no harm in stopping it.
Thank
it.
you.
Thank you.
Brooke, you were diagnosed with stage 1 breast cancer last year. You just finished your last round of chemo, so yay! It has been reported that women with hair type 3 and 4 may require further considerations in the instruction for preparing hair before scalp cooling treatment. The difference in thickness and structure of hair may be influential factors in its effectiveness. You are clearly a success story. Can you tell us what you do to prepare for treatment, how your care team in your infusion center, I should mention, Brooke is from New Jersey, helps you prepare, and did learning that there was more preparation perhaps on your end, did that in any way deter you or give you pause when you were making the decision to scalp cool?
Okay. Hi, everyone. Thanks for having me. I'm very happy to be here and share my success story. So as far as preparing my dose, I had Taxol weekly for 12 weeks straight. And so basically it was on Monday mornings, and the way I'd prepare was to get up extra early in the morning, rinse my hair, put leave-in conditioner in, detangle, and basically put it into 2 braids, made sure it stayed slick and wet. The leave-in conditioner is what helped to keep it slick. So then once the cap was put on, it would be very close to the scalp. I'd put on my shower cap, a clear shower cap, and then a winter hat. Head 35 minutes over to the center. And then as far as my care team, I call her guardian angel, but a representative for Paxman. And she basically would also just reapply more water. She'd add more leave-in conditioner. She'd put the cap on, make sure it was snug. She managed the machine itself. And she was just a great person just to talk to throughout the day. So I was very fortunate to have her. As far as giving me pause, I always had quite a long process with doing my hair anyway. Ever since the pandemic, I started doing my hair more often versus going to get it done. So it's always been a process. But what would have given me pause is if I didn't have the cap covered by insurance. At that point, it would have been, is it worth spending over $2,000 for something that will likely not keep 100% of my hair? But fortunately for me, I did have it covered 100%. So I was willing to do all the effort as far as, the process and preparing for my hair and getting it ready for the cap, as long as I had it covered, and it works really well for me.
Thanks, Brooke. And again, congratulations.
Thank you.
Abby, you are living with ER positive, HER2 positive metastatic breast cancer. You began using scalp cooling when you started the chemo regimen of docetaxel, Perjeta, and Herceptin. Tell us about your experience with scalp cooling as far as the process, the cap fitting. How did you begin your infusion with the cap? And then take us through the process for you, because you are treated right here at Yale. So let's talk about that a little bit.
Yes, I am. And thankfully so. I feel really lucky to have been treated here. I don't know how it could have been a better experience than it has been. I felt lucky. I felt as prepared as I could be because I have an older sister who has been going through treatment for breast cancer, the same breast cancer, for the past 30 years. So that in itself has been, such a relief, such a way for me to have faith and confidence in that there's always going to be, optionality and things to try. And scalp cooling was one of them. And she also had gone through that. So she very much encouraged me to watch the videos, to prepare myself as well as I could. So I did. My daughter actually came in to go to the first treatment with me, and I asked her to watch the videos, and she did. So we felt as prepared as we could be, which we really weren't, as well as we could be. So we got there, and the first thing I learned was that of the 2 scalp cooling machines, one of them was broken. So this meant that it was not just going to be me and my daughter, but I was going to have a roommate, and we were going to be doing this treatment together because each machine could deal with 2 people at a time. So that was, oh my gosh, I have to deal with, not only do I have to deal with this, but I have to deal with it with somebody else in the room who I don't even know. Well, I have to tell you that, and this is really telling the end of the story before the story is over, is I now have a chemo buddy and I have a friend for life. I mean, it was amazing. The fact that we could experience our first treatment together, that we could work off of each other, support each other, help each other, assure each other that while we thought this was absolutely going to be intolerable because of the brain freeze at the very beginning of the treatment, we could count down for each other, because the first treatment became tolerable after 10 minutes, I would say. Every subsequent treatment would become tolerable after, 5 to 7 minutes. And we would be there. The nurses were amazing. I mean, they put us in the same room. They made sure that we were together. They knew that we were buddies. They knew that we were going through this together, and they couldn't have been more helpful, more supportive. The nurses that my sister dealt with at one of the hospitals in New York, she had to do all of this by herself. So she would need to bring a friend with her or a sister to help her get the cap on, to help her get ready, and to do all the preparation. Here at Yale, they did everything for me. And I just felt so fortunate, so lucky. And it allowed me, I didn't keep all of my hair, but I did come here to Yale and I got a couple of wigs, and it was a really fun experience, actually, looking for wigs and trying them on and saying, okay, I like this one, I like that one. And one could be covered by insurance or by the amazingly generous donors here at Yale. So that one was covered. So I said, well, then I'm going to buy one and I'll have two. I never had to wear them. I mean, I would, in the back of my head, my hair was definitely thinning. I had long hair. I did cut it short, just to figure if I did have to start wearing a wig, it would make the transition easier. So I did cut my hair off, which is how I always used to wear it. But I would, turn around and look at the back of my head in the morning and I'd say, well, not too bad. It looks like, an old lady her hair is thinning. And that's, I think, what people are going to look at me and think. So I'm not going to bother with the wig. And I never had to, which was really, it was huge for me. And I think, we'll get into that and, in the next question, but the whole process, as I said, at first you think, I can't do this. It's too difficult. It's too painful. With the support from the nurses, from my chemo buddy, from anybody who came with me, to keep me company, I was able to do it. And as I said, for me anyway, it was, 5 to 7 minutes. And then I knew I would be able to do it and get through the rest of the treatment. And it was absolutely worthwhile. And I was really happy that I did.
Thank you. And that's important to note too, that it isn't a discomfort that you're going to have throughout the whole entire time, which I think is a lot of the misconception, is that you're going to sit there and it's going to hurt for the length of your infusion. Thanks so much. Dr. Shellhorn, the success of scalp cooling in preventing or reducing chemotherapy-induced alopecia is a variable between patients and chemotherapy regimens. Its success or lack thereof is not based on early stage or late stage cancer. What are the various factors that are used to predict the outcome of hair preservation success? And are there less favorable results with higher doses? And how does that play into the effectiveness in the metastatic breast cancer setting?
Okay, that was a lot of questions.
I know.
So, we have good data for early stage breast cancer with certain types of chemotherapy. Two of the most common types of chemotherapy that we use in early stage breast cancer are the taxanes. We've heard mention of docetaxel and paclitaxel down at the other end of the table. And there's very good data that scalp cooling works well when those regimens are used. The data that we have in terms of the papers, that especially the early ones that came out, were finite amounts of time. And so how we extrapolate that data to people with metastatic breast cancer, I think we're still waiting for more data. Other types of chemotherapy, drugs like adriamycin, or they belong to a class of medications called anthracyclines, less successful, but still some effectiveness of scalp cooling. I think the longer someone is on chemotherapy, we might expect that scalp cooling would be less effective over time, but I don't think we know that for sure. And there are a lot of other factors that play in. How well is the cap fitting? What's the mechanism of different types of chemotherapy? What's the rate of hair loss with chemotherapy with a certain drug without the cap? Drugs like Trodelvy and Enhertu don't have very high rates of grade 2 alopecia or more than 50% of hair loss. So there are a lot of things that play in, and every patient, we've heard this already today, every patient is different. So it's hard to predict. The way that I counsel my patients is, if this is important to you, we should try it, because it's likely to work better than without. And if keeping your hair is important to you, then I support going for it. I think we've got a long way to go in terms of insurance coverage. It sounds like New Jersey and Robert Wood Johnson has it all figured out, which is, I'd like to hear a lot more about that. But I think it really is about maintaining some self-esteem, maintaining some control, and presenting oneself in as positive a way as one can while undergoing treatment. So I don't know if I really answered your question, but I think there are a lot of different factors, and it works. Maybe not every time, and maybe not completely, but it does. It works.
Thank you. Dr. Lusberg, there's a study being done to compare rates of hair loss in people with MBC who use scalp cooling versus those who don't. This is a controlled investigation to assess the efficacy of Paxman scalp cooling at preventing hair loss in people undergoing treatment for MBC using Trodelvy, Enhertu, and Eribulin. One arm of that study assesses the quality of life. Is there a correlation, in your opinion, between retaining one's hair during treatment and mitigating other toxicities and side effects due to treatment?
Yes. So I do want to kind of, before I specifically answer that question, I do want to emphasize that, the National Cancer Institute definition of a cancer survivor is really any individual diagnosed from day one to the entire continuum of care for the rest of their life. And as a person who studies survivorship, I think what we have noticed is that unfortunately for the last few decades, the focus has been primarily on early stage breast cancers and not as much on metastatic cancers. And this is something that's changing. This is something that we have lobbied for, and NCI is now specifically, for example, asking for a portfolio of studies specifically focused on metastatic cancer and survivorship. So this is something that we really care about. And specific to scalp cooling, I think patients living with advanced cancer deserve to know that scalp cooling is an option. And I think this is something that I care passionately about. So it's important that this study is being done because we have a lot of new drugs that didn't exist when we were initially doing these scalp cooling studies, as you also heard Dr. Schellhorn mention. Specifically, the newer antibody drug conjugate drugs are associated with some hair loss that perhaps were not as highly reported in the initial clinical trials, but when we're actually using them in real world, we're actually seeing higher rates of hair loss. So patients need to know that we have limited data with scalp cooling with these agents. I'm glad that this trial is trying to generate that data. But in the meantime, I think if a patient is willing to try, I think it's important to offer that option. Specific to quality of life, absolutely. I think when kind of back to kind of the themes that we have all heard about from other panel members, kind of knowing that you have choices, that you have that sense of autonomy and control is absolutely important and associated with quality of life. And that sense of well-being, I think, can absolutely impact the entire toxicity experience of chemo. So I think for the patient where it matters, it absolutely matters. And again, it may not matter to every patient, but if it's important to her, then we do see that preservation of hair is associated with positive effects on other indices of quality of life and other toxicities. So I see that over and over again.
Thank you. Angela, until legislation changes on a national basis, success with the reimbursement for scalp cooling varies depending on the health plan, beneficiary coverage, and geographic location. I reviewed some of the steps necessary to even submit to insurance for coverage. And a lot of it is on the patient, right? So it's things such as asking your doctor for frequent progress report notes and getting copies of receipts, et cetera. Does the degree of difficulty on the patient in compiling the information ever play a role, do you think, in the decline of scalp cooling? And I'm thinking a lot about the patient population that we serve who is in such turmoil already, with everything they have going on, and they're single mothers and they're metastatic, and I mean, could go on and on. Does it ever deter?
Absolutely, 100%. I'm sure all of you in this room at one point in your life had a battle with an insurance company. And when you're not going through cancer treatment, it is stressful, it is overwhelming. And I get this like visceral reaction actually personal experience. But it is so stressful. And I can't even imagine trying to battle with an insurance company when you're going through chemotherapy, when you're a single mom living with metastatic disease and you have 3 small children at home. Not to mention, it really does require a lot of energy, physical energy, emotional energy, but also a level of savviness and education about the systems that you're working with, the hospital, the billing office, the doctor's office, the insurance company, what your benefits are. It is a lot. It is a lot, and it's a huge, huge burden. And so, but really, when I think about this, this is really about equal access to services, equal access to scalp cooling. And currently, right now, the majority of the women that I work with are the women that can financially afford scalp cooling. Yes, we do have wonderful organizations like you, Roberta, who have grants available to women, who have small children under 18 or single mothers living with metastatic breast cancer. And there's also another organization in the community called Here to Stay. But in order to qualify for a grant through them, you have to be at or below 300% federal poverty. And they only give about $1,000. And those of you probably are aware, it's thousands and thousands and thousands of dollars to pursue scalp cooling. And so when you're a single mother and you're working a full-time job, and now you're faced with having to access your family medical leave, your Connecticut paid medical leave, or maybe you don't have leave from work, depending on the kind of work you do, that means a reduction in your income, or maybe 60% of your income, a further struggle and burden to be able to meet your monthly living expenses. And when you have to choose between paying rent and scalp cooling, you're going to pay rent. And so again, it's really about not having equal access to services to any woman who would like to have scalp cooling available to her. And, we have our wonderful Rosa DeLauro, huge fan of Congresswoman DeLauro, huge fan. And, she, as many of you know, in April of 2022 has the Scalp Cooling Therapy Act, and that will force insurance companies to cover scalp cooling. And what that will do is that will hopefully level and make it more equal for patients who want to pursue, who want to have access to scalp cooling, to be able to do so. And what that will also do is it will allow women to take back some of that control that cancer takes away from them when they're going through treatment, and to be able to have that opportunity. And hopefully, if that bill, and please let's hope that bill passes, it will then create women, to have, it will impact their emotional well-being, hopefully improve it, as well as their quality of life. So thank you.
Thank you. And I want to just point out that Jen Lamb is with us today, and Jen is from Congresswoman DeLauro's office. So thank you, Jen, for being here. Appreciate it. Elisa, do you ever sense that some patient populations may feel inferior in the infusion room when they can't utilize scalp cooling due to financial disparities, but they're sitting among a patient or patients that can?
Yes. So this was really hard when we first started, especially because we treat ovarian cancer patients in our infusion room. And when we first started, it was only for breast cancer patients. So we actually hid the breast cancer patients in a cubby so that the ovarian cancer patients couldn't see them, because it was hurtful to them that breast cancer patients could have a source for scalp cooling and saving their hair, and they couldn't. So they would always say, even now, patients even say, what is that? Why do they have that on? Why can't I have that? Now we have more education. Ovarian cancer patients can have it, but when it comes to financials, like some people cannot afford it, and it's not fair. Not everybody has infinite strength. Not everybody has Here to Stay is amazing. I just had a patient qualify for it, and they got the funding within 24 hours, but they have to be reimbursed. So that's another problem. They have to come up with the funding first and then be reimbursed to be able to have the scalp cooling. So I have a patient right now in the process of figuring out how to pay and come up with the finances for it. But when patients look at someone who has their hair and then they're bald, it's really hard for them to deal with that. And some people get really upset. So we have to talk them off the ledge, and sometimes have social work come in because they just don't have the financial ability to do it. And then there's wigs. and some wigs don't look like their own hair, which is really sad. So having infinite strength, having hair to stay, and if it's approved for insurance companies would be amazing. Or having, I'm going to put our doctors on the spot, a Paxman liaison in our infusion center to help us would be amazing too. To help because it helped her. Sorry, put you on the spot. Because it seemed like it worked really well in New Jersey. They have their stuff together. And then we'd have more time for our patients. But it is amazing. So having that financial support with insurance would be 100% much better for our patients.
Thank you. Brooke, you told me that when you were trying to determine if scalp cooling was right for you, you went to the website to do some research. Tell us about what you found and how that helped you make the decision.
Sure. So I first heard about the cooling cap from actually one of my coworkers. I work in pharmaceuticals. She's in marketing. She just mentioned that someone she knew was using the cooling cap, and I'd never heard of it. So I started looking online, and I found out from the cancer center that I went to that they said, take a look at the Paxman site because that's who they work with. And for me, when I hear there's hair product, not every hair product is for Black hair. So I assumed, okay, let's see if this would work for someone with my hair. I looked at some of the studies and it showed that there weren't many Black women that were in those trials. So it wasn't the most favorable for us. And then I saw the videos, and the videos, there were two, not just one for general Black hair, but there were two different hair types for Black hair. And I was really amazed and impressed by that. And I could see like, okay, this one looks more like my hair. Let's see how she's getting her hair together. And at that point, I felt like, okay, they're looking at us too. They see us. And like I mentioned before, once I found out that my insurance would cover it completely, I figured let's give it a try. I also had bought 2 wigs ahead of time in preparation for losing my hair, and only my daughter, my 9-year-old, likes to play with them. and that's it. So I was very happy with the information I found and grateful that I did it.
Thanks, Brooke. Abby, receiving an MBC diagnosis is devastating. It's life-changing. Yet seeing you today and we hear you speak and you're so positive. Knowing that many of the people you interact with every day don't know about your diagnosis, do you attribute much of your outlook to the fact that you've been able to retain your hair? And you're going to close out this discussion. What has it meant to you as you try to remain, have some semblance of normalcy in your life and just live your life?
So being able to keep my hair has really allowed me to continue on with life as usual, publicly. I mean, in private, my close family, my daughter, my sister, my very, very close friends. But as far as colleagues go, because I'm still working full time, I'm very fortunate because I'm a home office worker. So I'm on video all the time. But even if the hair was thinning in the back, they only saw the front view on the video screen. So I didn't have to tell anybody. I didn't have to deal with it. I could just continue on, life as usual. And I had an experience with bladder cancer, from 2017 to 2020 with, treatments and surgeries and eventually a bladder replacement. And then in 2021, when I got this diagnosis, it's like, okay, here we go again. And, with the bladder cancer, there was no problem, no hair loss or anything. With this, being able to keep my hair allowed me to keep my privacy, allowed me to stay in control of my life, who I wanted to share my situation with. It was totally up to me, because I can really resonate with, whoever was talking about someone, I think it was you, Roberta, saying people would come up to you and say, how are you feeling? How are you doing? And, I'll take that question from my daughter and my sister, but I don't want to hear it from everybody. This is something we're living with every moment of every single day. And I really don't need to share it with anybody unless I want to share it with them. So this is what the keeping my hair and the scalp cooling has really allowed me to maintain control over my life, and to keep really, just yesterday is the same as today. It really has allowed me to do that. And I'm really, really thankful for that.
Thanks, Abby. That was a really nice note to end that on. Does anybody have any questions? No? I want to also thank Karen Buck. Karen from Paxman is here. She is the vice president of their US operations. And thank you for being here. So no questions. We're at the end of our panel discussion. I want to thank you again for recognizing this importance of this topic. You know, one thing we didn't cover today, but I am going to just throw this in, and we'll probably delve deeper into it in another time, but it doesn't just affect the patient, the hair loss. If they're moms, it affects their kids. So speaking from experience, when I was diagnosed, my daughters were 14, 13, and 10. And the day I lost my hair is the day they couldn't look at me. No eye contact. They did not want to see me without a wig. And even with the wig, they really didn't want to look me in the eye. And it was a gut punch. But I also think, what did it do to them? Because for them to have that reaction to me, I think what it did to them had to be worse. So I really hope that we get this legislation passed. I thank you all, and please continue to spread the word. We dispelled some of the myths here. So hopefully things will change and improve. I mean, we're going in the right direction. Things are happening. So thank you again. Thank you to all the panelists for being here. Really appreciate it. And we'll see you again very soon.